Felty's syndrome is a rare condition that is often associated with rheumatoid arthritis, characterized by a unique combination of symptoms that can impact the quality of life of those affected. If you're not familiar with this syndrome, stay tuned as we delve into the details of its causes, symptoms, diagnosis, and treatment options. The primary symptoms of Felty's syndrome include rheumatoid arthritis, splenomegaly, which is the enlargement of the spleen, and leukopenia, or a reduced white blood cell count. Patients may also experience recurrent infections due to this lowered white cell count, anemia, and fatigue. The syndrome mostly affects adults, particularly those with a long-standing history of rheumatoid arthritis. Approximately 1 to 3% of rheumatoid arthritis patients may develop Felty's syndrome over their lifetime. The exact cause of Felty's syndrome isn't entirely understood. However, it is believed to have an autoimmune basis. In autoimmune diseases, the body mistakenly attacks its own tissues. In the case of rheumatoid arthritis, this results in inflammation of the joints. Over time, this inflammation can affect the spleen and bone marrow, resulting in the systemic effects seen in Felty's syndrome. Research indicates that genetic predispositions may play a role in its development, and it is more commonly seen in Caucasian individuals and more prevalent in women than men. If you suspect you or someone you know may have Felty's syndrome, it's important to seek medical advice. Diagnosis typically begins with a thorough medical history and physical examination. The healthcare provider will inquire about symptoms, any history of rheumatoid arthritis, as well as any instances of recurrent infections. Laboratory tests are essential for diagnosis, including a complete blood count to assess for leukopenia, liver function tests, and possibly imaging studies like an ultrasound to confirm splenomegaly. Once diagnosed, managing Felty's syndrome becomes a priority. The treatment primarily focuses on controlling rheumatoid arthritis and may include disease-modifying antirheumatic drugs, commonly known as DMARDs. Methotrexate is a popular choice, as it helps reduce inflammation and can lead to an improvement in symptoms. Other medications may include biologic agents that target specific parts of the immune system. In cases where anemia is a concern, iron supplements or other treatments may be necessary. It's also crucial for patients to address their symptoms collaboratively with their healthcare team, ensuring a holistic approach to their care. In certain circumstances, if patients experience severe splenomegaly or complications from infections, a splenectomy, or surgical removal of the spleen, might be considered. Additionally, patients should be educated on the importance of infection prevention given their increased susceptibility. Awareness about vaccinations, good hygiene practices, and recognizing the early signs of infection can be a life-saving approach. Regular medical checkups are also vital for monitoring the condition, reviewing treatment efficacy, and making necessary adjustments. It's essential to note that living with Felty's syndrome can be challenging, so psychological support should not be overlooked. Connecting with support groups or mental health professionals can provide substantial benefits in coping with a chronic condition like this. Research on Felty's syndrome is ongoing, with studies aimed at better understanding its pathophysiology and developing more effective treatments. With advancements in medical science, there is hope for improved management strategies and possibly even curative approaches in the future. In conclusion, Felty's syndrome is a serious condition that requires prompt diagnosis and proper management. If you have a history of rheumatoid arthritis and are experiencing symptoms like recurrent infections, fatigue, or splenomegaly, do not hesitate to consult your healthcare provider. Understanding the link between rheumatoid arthritis and Felty's syndrome is crucial for early intervention. Thank you for watching, and be sure to like, share, and subscribe for more educational content on medical conditions and health awareness.